All right, let's jump right in. We have a stack of material here today, and it's all focused on a role that's really foundational in healthcare, but maybe a bit behind the scenes. The certified coding specialist.
That's right. And what's interesting, I think, about these sources is how they approach it. They give us this window into what a CCS actually does,
Yeah.
but through the lens of common interview questions and the kind of answers expected.
Yeah, it's a really practical angle.
It really is. Sort of grounds it in the day-to-day realities of the job.
Okay, so our mission then for this deep dive, take these sources, pull out the key stuff. We want to understand, the core responsibilities, maybe some unexpected challenges, and why this role is, well, more than just assigning numbers. What does it really take? Let's get into it.
Well, at its heart, what these sources describe is a translation role. You're taking really complex medical records, doctor's notes, lab results, all that, and translating it.
Translating it into that alphabet soup of codes we see everywhere in the material. ICD-10, CM, CPT, HCPCS, Level 2.
Exactly, those specific systems. The sources really stress that experience with them is just fundamental. Like CPT and HCPCS Level 2, they're highlighted as absolutely essential for billing. They cover procedures, services, even things like medical equipment.
And the reason for this translation, it's all about getting the billing right, obviously, but also staying compliant, right,
Yeah,
with
yeah.
all the healthcare regulations out there.
Absolutely. The material makes it super clear. This isn't just about, getting paid.
Yeah.
It's fundamental for proper reimbursement, yes, but also for data integrity. That's a huge piece.
Data integrity. Yeah, that feels big. It means these codes don't just vanish after the bill goes out. They feed into research, public health, quality metrics.
Everything. Yeah, they have this downstream life.
Yes.
And that's why the sources just hammer home that accuracy is completely non-negotiable.
So, okay, how is that level of precision actually achieved based on what we're seeing here?
It looks like a few layers. One is strict adherence to the official coding guidelines. Another is just meticulous cross-checking of every detail in the documentation.
Right.
And then there are things like regular coding audits, peer reviews. But a key thing that comes through is that accuracy isn't a one-and-done thing. It needs constant work.
Constant learning.
Yes, exactly. Staying updated is explicitly called essential. Using resources like AAPC and a HIMA, going to workshops, reviewing those quarterly updates from CMS and the AMA, you have to stay current.
Okay, so it really demands continuous learning, rigorous self-checking. But what about when the documentation itself isn't, perfectly clear? Medical notes can be written fast. Sometimes they're ambiguous.
Oh, for sure. And the sources tackle that head on. If a coder finds inconsistencies or something's missing, they can't just guess.
No assumptions.
Right. The material describes this process of querying the physician, asking for clarification. Often it involves using like a standardized query form. It's a formal process.
And that step is vital.
Vital. For both coding accuracy and staying compliant with billing standards, you need that clarification documented.
That really highlights a problem-solving aspect, almost investigative. I mean, one of the sources gives a specific example, finding a misdiagnosis code that was actually going to impact reimbursement.
Yeah, I saw that one.
And the response wasn't just, oh, here's an error. It was documenting it, starting that physician query process, and then correcting the code and resubmitting the claim after getting the answer.
Right.
That single action had a direct financial impact.
That example shows the stakes perfectly.
Yeah.
And it's not just fixing errors they find. A lot of the focus described is on preventing problems, like claim denials, from even happening.
Proactive then.
Very much so. The sources point to accurate coding, obviously, that thorough documentation review we talked about, and correctly using things called modifiers. Those are key to preventing denials. Plus, working closely with the billing teams to get what they call clean claim submission.
Okay, so managing, I imagine it's a high volume of charts sometimes. While keeping up that level of detail and communication, that sounds like it requires some serious organization. How do they handle that pressure, according to these documents?
Prioritization comes up a lot. They need to prioritize based on deadlines, claim submission schedules, sometimes just how complex a case is.
Makes sense.
And the material also notes using coding productivity tools is pretty essential. To manage the volume efficiently without sacrificing the accuracy, it's a constant juggle.
So staying organized, maybe blocking out time for focused work, that helps meet deadlines while keeping the quality high.
Exactly. It's that productivity paired with unwavering quality. The sources mention little things too, like keeping reference materials handy, maybe using templates, ways to streamline the process efficiently.
Right, not just speed for speed's sake, but efficient accuracy.
Precisely. And underpinning all of this is the technology piece. The material really highlights needing experience with electronic health record systems, EHRs.
Like Epic, Cerner, MedTech,
Hmm.
those names pop up.
Yeah, those are the big ones mentioned. Those are the platforms where they're actually reviewing the charts, finding the physician notes, inputting the codes. It's their daily operating environment.
The sources also touch on some more specialized coding areas, risk adjustment or HCC coding, especially for Medicare Advantage plans. What's the significance there?
Ah, that's a great example of how coding accuracy has these broader ripples. Accurate risk adjustment coding directly impacts how much plans get reimbursed based on how complex, how sick their patient population is. It also feeds into quality reporting metrics.
Okay, so it affects funding and quality scores.
Definitely. And another specialized area the sources bring up is DRGs, diagnosis-related groups.
DRGs, I've definitely heard that term. How do those fit into the coding picture?
So DRGs are basically how inpatient hospital stays get categorized for payment, mostly under Medicare. They group cases together based on diagnoses, procedures, patient age, other factors.
Oh.
And the material emphasizes that accurate coding directly determines the correct DRG assignment, which in turn dictates how much the hospital gets paid for that entire patient stay.
Wow. Okay, so the coder's precision directly impacts the hospital's bottom line through these DRGs.
Yeah.
That's significant.
It really is. And all this work, whether it's standard coding or DRGs, involves handling incredibly sensitive patient data.
Yeah, how is that managed, according to the sources?
The strict IPICO compliance is just paramount,
Mm.
non-negotiable. The sources stress using secure systems, making absolutely sure patient information is never shared improperly. Confidentiality isn't just a rule, it's framed as critical for trust, for the integrity of the whole system.
So if we try to sum this up, it's a remarkably multifaceted role. You need deep technical knowledge of these complex coding systems, incredible attention to detail for digging through documentation,
Ridiculous, yeah.
clear communication skills for those physician queries,
Crucial.
strong organizational skills for the workload, and this unwavering grasp of compliance and data security.
That sums it up pretty well. And it looks like the field supports newcomers too. The sources mention training approaches, like starting new coders with guideline reviews, supervised practice, getting regular feedback.
Building skills and confidence.
Yeah, it suggests there's a collaborative element in mastering this complex work, which makes sense.
It really sounds fundamental to the whole financial and data infrastructure of healthcare. It's easy to see why, as one sample answer puts it, someone with strong technical expertise, attention to detail, and a deep commitment to compliance and accuracy would be so valuable.
Yeah, and what's fascinating is connecting all those individual tasks we talked about. Assigning one CPT code, querying a doctor, figuring out the right DRG, connecting that to the bigger picture.
Right.
They're ensuring the whole system functions correctly. Compliance isn't just, avoiding penalties. The sources imply it's about maintaining ethical practices, safeguarding everyone by reducing risks like audits and fraud.
It's proactive problem solving. That invisible but absolutely vital work behind the curtain, translating services into the language that keeps things running, ensures proper payment.
So, okay, let's try to synthesize the key takeaways from this deep dive. A certified coding specialist is like a master translator, medical language to standardized codes, essential for billing, essential for data.
They're also detectives, right? Scrutinizing documentation, querying doctors to clear up ambiguities, catching critical errors.
Absolutely. And guardians of compliance, navigating HIPAA, OIG guidelines, all of that. They're problem solvers, preventing claim denials, ensuring correct categorization like with DRGs.
And they have to be committed to constant learning in a field that's always changing.
Always evolving, yeah.
This role is just crucial, not just for billing or data integrity for research, but fundamentally for the financial health and the compliance of the entire healthcare institution. It's way more than just admin work.
Much more. It's highly skilled, really critical.
Thinking about everything we've pulled from these sources, you should consider the invisible work happening behind the scenes. Every single service, every diagnosis, it has to be translated into this precise coded language. That's how it gets documented correctly, how reimbursement happens.
Yeah, it's the engine room, in a way.
Which leads to a final thought based purely on what's implied in these sources we looked at today. Think about how the precision and that intense attention to detail required of a CCS, everything from catching one misdiagnosis code, like in that example,
Uh-huh.
to correctly applying a modifier or assigning the right DRG, how that directly impacts the entire healthcare system. From the accuracy of your own patient record, potentially, all the way up to the financial stability of hospitals.
Really makes you wonder.
Exactly. How much of healthcare's basic operational success truly hinges on this precise, often hidden work? Something for you to consider.